Hi, I'm Stephanie. I've been working here at Mountain Springs Recovery since June of 2023.
And what's your role here at Mountain Springs?
I'm in the intake department, so we are the first faces that our soon-to-be clients see when they come in here, and we kind of get them on started with the process of becoming our client and on the road to recovery.
What made you interested in working in recovery?
Well, in my past, I have worked with the population of parents being trying to get the recovery and get their kids back. It was more of a foster care organization that I work for. However, recovery is a part of my journey, so I want to get more in the trenches with a recovery center.
Nice. And I know a lot of people are doing sort of dry January nowadays, and not many people know the risks of alcohol withdrawals. Are there any things that you think that people should be on the lookout for when starting to try to get sober on their own?
Yeah, I would say stopping cold turkey isn't always the best thing. If you're one to rely on alcohol, kind of on a daily basis, and in order to feel like you could function, you can't function without it. My advice would be to seek for help. One, because there does come a point where it kind of becomes uncontrollable. So I would say, you start feeling tremors are a huge sign. If you start tremoring out, it's very common, unfortunately, but that is part of it. I would going into seizures is a very big risk that you take. Many people have seizures if they've been detoxing and they stop cold turkey, and they don't even realize that what's happening at the moment, obviously. So tremors, seizures, headaches. If you're feeling yourself that you have to rely on it literally to stop your tremoring, that's a huge sign that help might be the best thing for you.
And when you are saying tremors and seizures as being part of withdrawal, how common are those symptoms when trying to detox from alcohol on your own, or does it depend on the severity of the addiction?
I would say it depends on the severity. Speaking from personal experience, early on that wasn't the case. You drink, and obviously it does come with age sometimes, and you just bounce right back. And you feel like you have it under control. I think as time goes on, your body just starts basically giving out, and so that's when you will most likely eventually start moving into the tremor phases. Usually when people reach recovery, go into recovery, it's because they're usually unfortunately feeling something and just know that they need the help. It typically takes a long time to get there, because a lot of people don't, it's what you make it. It's what you call yourself. Some people will call themselves alcoholics. Some people don't. That is your choice. So I think once people reach that point where they may say they've, come to terms that they are an alcoholic, that's when they would seek treatment. So that's what I see mostly here. I've been involved personally, in my personal life, and seen many people, and also with my job, obviously.
So when we're talking about these withdrawal symptoms, are these things that you can recognize and sort of ignore and just push through on your own, like if you're starting to get the tremors? Or if you're starting to get the tremors, is that an indication that you need to go seek medical attention right away?
Many times if you've reached a stage where you're tremoring pretty heavily, it is a matter of going to get help. You start shaking, you can't even play it off. It's just something that's out of your control, and that's kind of where it leads to. And you have to rely on, one, people feel like they have to rely on, that's why they keep on drinking, to feel better, because once you have that drink, you start feeling better, but then it's just a vicious cycle. So when people want to get out that vicious cycle, it's usually when they come to a treatment center.
And do you have any advice for somebody who's looking to get sober or is maybe trying on dry January this season?
I would say your mind definitely has to be in it. You have to want it. I'm not going to sit here and say it's easy. It's never easy. So if it was that easy, people would just be able to stop on their own. I would say reach out, seek for help, try different things. Some people enjoy meetings, some people enjoy just going to recovery outings, things like that. See what kind of fits your needs. That's really what worked for me. Getting out of your environment is a big one. For me, I didn't leave my original state to go into recovery necessarily. However, I knew that was my goal. So here I am. Didn't ever think I would be sitting here, but I am. And many times here in recovery, we say things not to gloat. We say it because we want everybody to know that it is possible.
That's awesome. We're so proud of you.